Hey there. I really liked watching this video relating to being obsessed with being compulsive and the symptoms of pathology. Basically, explaining these would be obsessive and categories of obsessive and compulsive. Obsessions would be reoccurring thoughts that are intrusive and may give you urges that are unwanted, give anxiety and distress of feeling unsafe. And compulsions would be repetitive behaviors like washing hands or checking the door, making sure it's locked all the time, praying, counting repetitive words silently, rigid rules, behaviors, coping with mechanisms like a dreaded event or situation that could happen. This is meant to prevent future anxiety. And it's mostly seen in young children, but some people may only have obsessions or only have compulsions, but most of them have both. They use this coping and relief mechanism of a compulsion performed to achieve or alleviate an obsession, like cleaning, in order because they're having issues with germs and having contaminations. But sometimes it could be checking and unlocking the door repeatedly a number of times, like, or a certain number of times, and to be reassuring that nothing bad could happen and order and arrange things and items, because if they're out of order, it causes massive anxiety sometimes and discomfort in their life. Mental rituals like good thoughts, cycling to replace bad thoughts really help them. The DSM 5 diagnostic book is a guiding us to diagnose different things, different disorders like OCD. In order to meet OCD criteria, being categorized by displaying obsessions, compulsions, or both, they're often time consuming and can cause distress and anxiety in social, work, and relationships, making it hard and time consuming to finish things like folding clothes or obsessively getting ready, like meticulously doing makeup or hair and being late for work, not due to psychological effects of substance or medical condition or anything, but it's better explained by another disorder like the dysmorphic disorder, which is the obsession of your personal appearance. I believe Marilyn Monroe had that. She had stage fright as well, so that was very interesting. The cause is unknown. It could be genetic or environmental. Identical twins have it more than non-identical twins, which is very interesting. There's a serotonin neurotransmission deal there. So the treatment is best used by psychotherapy, CBT, cognitive behavioral therapy, and using the method of exposure and response, exposing the fear or anxiety or worry in order to get a response. This is basically to lower their anxiety without having compulsion attached to the person's fear or worry. This medicine they can take is SSRIs, and its symptoms and side effects sometimes make it harder for the patients because they would have to seek out more medical or more medicine and more psychotherapy in order to counter effect these side effects and symptoms that they would be getting. But all in all, I really thought it was very interesting because I learned a lot. I learned that it could be seen as other anxiety because OCD is kind of sometimes hidden. I wouldn't know that people like David Beckham or other stars would have it because they just don't display that type of thing when they're performing. But I'm sure it would be hard to have OCD as a performance based career. I thought that was very interesting. So, thank you so much.